Talking Points Memo is reporting on a brand new healthcare poll that just came out. They say, a new poll suggests the country may be shifting left on the issue of healthcare, with 62% saying it's the federal government's responsibility to make sure that all Americans have healthcare coverage, while 37% say it's not. The survey findings from the Associated Press and ORC Center for Public Affairs Research indicate a change in public attitudes over the past few months, as concerns mounted about GOP legislation estimated to leave tens of millions without coverage. So that's a record. I've never seen a number that high. 62% of the country now says it's the federal government's responsibility to make sure that all Americans have health care coverage. And that framing is actually harder to get the higher number than if you were to say Medicare for all. If you just say Medicare for all, it would be even higher at this point. Because saying it's the federal government's responsibility to make sure they have it, people tend to go, ooh, that means big government. I don't know if I'm in favor of that. But if you say Medicare for all, they get a higher number. So we got 62% when they framed the question in a way that wasn't even favorable to answering yes. To put that in perspective for you, the same poll in March, just 52%. Now, it was still a majority even then. But we're talking an increase in 10 percentage points in that short a time span? Whoa, man. Whoa. And what's the difference? What's the difference? Stop and think about it. Well, we have Bernie Sanders, who's been busting his ass since the second he really burst onto the national scene, and that really gained the notoriety, letting everybody know about the concept of Medicare for all and how every other nation has one version or another of a single-payer system, so, we're getting screwed. There's Bernie Sanders doing that, and then there's what? You guys. There's National Nurses United, there's brand new Congress, there's Justice Democrats, there's the Green Party, there's Democratic Socialists, there's populist left progressive activists who've said, I've had enough. I've had enough. I'm done with the fucking bullshit. Yes, let's compromise on things that aren't even debatable from the Democrats. No, this is a non-negotiable. Medicare for all, that's not negotiable. That's one of the core, fundamental, bedrock policies and principles of somebody who's supposed to be on the left. So if you want to come around and say, oh, I don't know if I'm in favor of that, okay, well, we're going to raise fucking hell. That's what we're going to do. Look at what's happening in California, man. In California, it was killed. The single-payer bill was killed by Anthony Rendon. He just decided we're not going to have a vote on it. Excuse you? This is a Democrat who, by the way, in the next breath says, oh, and I'm for single-payer. What? Yeah, I'm for single-payer, but the sun was in my eyes, and I had some bad fish that day, and I just wasn't sure the provisions, subsection L, area 23, line 9. It doesn't say it's exactly right, so I'm just gonna shelve it. And then the response has been a giant backlash because Anthony Rendon is basically putting people in a position where he's sentencing them to die. Yeah, I said it because it's true. It's true. The number of people, we have 45,000 people that die in the U.S. every year because they don't have access to basic health care. Under Trump care, that number would kick up to 58,000. So the debate we're having is between 45,000 and 58,000 people dying. How about none? How about nobody dies because they don't have access to basic health care? How do we do that? Medicare for all. It costs less and you cover everybody. It costs less and you get rid of the for-profit middleman, the price-gouging for-profit middleman of the private health insurance companies. So there's been massive organization around this issue because it's not enough for the Democrats just to say, hey, Trump care sucks, let's defend Obamacare. No, Obamacare was only a quarter of the way that we had to go to really change our healthcare system. So it was a beginning and it was a step in the right direction. But that's not the end-all be-all. The end-all be-all isn't a fucking piecemeal system that keeps the private health insurance companies intact and in control. Fuck that. No, the answer is Medicare for all. But now, because of the organization, because of the megaphone of Bernie Sanders, and because of the raising of awareness and young people who are more educated who learn about this stuff, 62%. Yeah, we're not fucking around. We want Medicare for all. So it's time for the politics to catch up to the popular opinion. Now, with with some issues, it just drags behind like there's no tomorrow. I mean, 80% of people want to raise the minimum wage. We haven't gotten a minimum wage increase. And the list goes on and on of the different, what was it? 58% finally is what the gay marriage approval was when we got gay marriage as law, but that was because the Supreme Court intervened and said, yeah, this is a constitutional right under Equal Protection Clause. So we got to find some way, man. We got to find some way to get Medicare for all, whether it's state-by-state basis and each individual one falls, or whether it's at a federal level, or whether it's somehow there's a case that gets to the Supreme Court and they determine under the Equal Protection Clause for healthcare that, yeah, you can't, have a system where 45,000 people because they don't have access to basic care. Whatever it is, we got to win. And just understand we are chipping away. New York was on the verge of passing it. California was on the verge of passing it. Vermont passed it before it was attacked and killed by the health companies. So we got to keep pushing. Never give up, because this is not a question that's debatable. And remember, if you ask people, when it goes back to the civil rights movement, if you ask people in 1959 in Mississippi, activists, hey, are we ever going to get desegregation? They would have laughed in your face and said, no. We're going to keep fighting, but come on. Is this going to end? This is how it is. And then it wasn't. So you got to think the same way with healthcare. Are we ever going to get Medicare for all? Come on, man. This is how it is. If we keep pushing, maybe it won't be anymore. So let's keep fighting. By the way, justicedemocrats.com/single payer, justicedemocrats.com/single payer. Go sign that petition, because it works. We went from 72 co-sponsors to the Medicare for All bill in the House to over 115. That's all because of you guys and your organizing. So sign that petition. If you haven't called your congressman, call your congressman and tell them, look, support this or we're going to vote you out. And of course, justicedemocrats.com/fight if you want to donate to get Justice Democrats elected, which of course is monumentally important.